Hello everyone. This is Marie, your instructor from UMA. Welcome to BC 2030. We're going to be covering chapter 26, 27, and 16 this week. Chapter 26 deals with the endocrine and nervous systems. The endocrine system contains 9 glands. Only 4 are included in the endocrine subsection of the CPT book. Those are the thyroid, parathyroid, thymus, and adrenal. The pituitary and pineal are located in the nervous system, and the pancreas in the digestive system, ovaries and testes in the respective genital systems. The endocrine system is divided into 2 subheadings, the thyroid gland, and then the parathyroid, thymus, adrenal, pancreas, and carotid body. The carotid body refers to the area adjacent to the carotid artery. This can be a site for tumors. So this is an area that we could concentrate on if coding for tumors in this area. The thyroid gland excision subsection includes 2 lobes. The code descriptions often refer to partial subtotal excisions. Total would be all. Partial removal would be called a lobectomy. Total thyroid lobectomy would include solitary nodules, follicular adenomas, nodules, and goiters. The nervous system divided into skull, meninges, and brain, spine and spinal cord, extracranial nerves, peripheral nerves, and autonomic nervous system. Here we have an image right over here, and we can see the meninges includes the 3 layers, dura mater, arachnoid, and pia mater. And procedures would be, for example, injection, drainage, or aspiration, twist drills, burr holes, or trephine. Skull, meninges, and brain subsection hold conditions that require openings into the brain. For what? To relieve pressure, insert monitoring devices, place tubing, or inject contrast material for imaging. Procedures could be craniectomy or craniotomy. Removal of portion of the skull would be a craniotomy. Codes are divided by site and condition. Skull base surgery would include the area at the base of the cranium. For example, a lesion removal from this area. It would be very complex. Extensive category notes are included. Surgical management of lesions in the skull base often involve surgeons from different specialties working during the same operative session. Different specialties would include with your modifier 62. You can find those in the back of the front cover of your CPT book. Surgery of skull base terminology. The approach procedure is important to understand. It is used to gain the access exposure of the lesion. The definitive approach is actually what is done to the lesion. So again, approach procedure is to gain access. Definitive procedure is what is done. Repair and reconstruction procedures are reported separately only if there's an extensive repair. Approach procedure and definitive procedures are coded separately. Example, removal of intradural lesion using a middle cranial fascia approach, infratemporal preauricular approach procedure, middle cranial fascia, definitive procedure of intradural resection of a lesion, etc. Cerebral spinal fluid shunt, CSF shunt. You have this week a question on to code for a shunt. The shunts are used to drain fluid. The codes are describe the placement of the devices, repair, replacement, or removal of shunting devices. Spine and spinal cord codes are divided on the condition and approach. Other important coding considerations would be whether it's unilateral or bilateral. If bilateral, you would use the modifier 50. Or multiple procedures, modifier 51. Those who remember are procedures performed in the same operative sites by the same physician on the same day. Radiologic supervision and fluoro guidance are reported separately. Spine and spinal cord, many codes in the nervous system involve conditions responsible for the procedure, like, for example, an abscess, a cyst, hematoma, foreign body, etc. Introduction is a main term that you can find in your CPT book. So introduction and injection of an anesthetic agent can be for diagnostic or it can be for therapeutic purposes. The codes are included for nerve blocks, facet joint injections, epidural injections, and mainly used to provide pain relief. This is conclusion of Chapter 26, Endocrine and Nervous Systems. Hope that you enjoyed this session and see you later.